Using MolecuLight for fluorescence imaging of wound bacteria is an important and useful component of so many of our wound care practices. And just like every other service we provide, there are coding and documentation considerations that accompany the provision of this service. I am Dr. Jeff Lehrman, podiatrist, certified professional coder, and certified professional medical auditor. When using MolecuLight for fluorescence imaging of wound bacteria, there are CPT codes for that service, and they are CPT 0598T and CPT 0599T if more than one wound is imaged. And when submitting that coding, when performing this procedure, there are documentation considerations to keep in mind. And the first that I suggest you keep in mind is the need to document the medical necessity of the service. Documenting the why. Why did we perform this service? This is required of all services that we perform. So when using MolecuLight for fluorescence imaging of wound bacteria, it is important to document why it was done. And a suggestion of a very good way to accomplish that is by including a sentence in the note that starts with, fluorescence imaging of wound bacteria was medically necessary today because, and then you fill in the blank with whatever is appropriate for that patient, for that presentation. Why did we perform the imaging today? You know why you did it, right? We learned that in school and in our training. We know why this is important. It should be documented. And I think some providers are frustrated by that, but that is what many of the third-party payers are looking for, that documentation of why. In addition, it is important to document the results, what we saw. Did we see color? What color did we see? Where was that color? What element of the wound was involved, and how much of it did we see? And it is important to document the steps by which we accomplish the procedure. If you're a surgeon, you can think of it as a miniature operative note. The patient was placed in this position. Attention was directed to. Also including the method by which you achieve the clinical darkness that is necessary to perform the imaging. All of the steps that you performed in order to accomplish that fluorescence imaging of wound bacteria. And include what decisions were made based on the results that were achieved. The third-party payers want to see if we're doing this, they want to see that it is resulting in some decision making. So if we were to perform fluorescence imaging of wound bacteria and see nothing, that influences decision making. That might lead to our decision to use a certain product or to not use a certain product. I'm mentioning this because oftentimes people ask, what if it's negative? Well, that's okay. That's a useful result that informs decision making. So in the case of not seeing any bacteria, we document what decisions we made based on that result. And in the situation where we do see bacteria, what decisions were made as a result of seeing the bacteria in the wound bed. When submitting the CPT codes that we mentioned earlier, it's important to document everything we just said and to document that we performed the service that the CPT codes represent. So the suggestion is, if we are going to submit CPT 0598T, 0599T, that somewhere in that documentation we include that we performed non-contact real-time fluorescence imaging for bacterial presence, location, and load. That's what the CPT descriptor is. And third-party payers are often looking for documentation of the service that the CPT code represents. Not necessarily looking for a branded name in that note. While that's fine to include, they're very likely looking for the words included in the code descriptor. In summary, be sure to include the medical necessity of the service performed, the why we performed fluorescence imaging of wound bacteria, the steps taken to achieve that imaging, including the method by which you achieve the clinical darkness needed to appropriately image, the results, what did we see, and finally, what decisions were made based on the results that we observed. I hope that you will take advantage of the many benefits realized by incorporating MolecuLight into your practices, and that this guidance is helpful in ensuring appropriate coding and documentation when performing that service.